My name is Jorg Matthes from the University of Vienna in Austria, and I'd like to thank you for the opportunity to be able to present at this conference. Today, I would like to present a paper entitled Seeing or Believing Fake News, Misinformation about COVID-19, Locus of Control and Perceived Threat. These days, it doesn't come as a surprise when I say that the majority of citizens are exposed to misinformation or disinformation. And we also see this during the COVID-19 crisis. In fact, data suggest that the majority of citizens actually report they have seen what they call fake news. Typically in research, we ask what are the outcomes of the actual beliefs in such misinformation. So when people believe this, what does it do with them? In this paper, I'd like to suggest a slightly different frame. It's not about the belief in misinformation, it's just about the mere perception of such misinformation. So what kind of psychological outcomes can these misinformation perceptions have? And I argue that even though individuals may not necessarily believe in false information, nevertheless, the impression that this information is out there can have important psychological consequences. Why is that the case? Because individuals may believe that misinformation may make the pandemic more difficult to control, because the spreading of misinformation may potentially also guide the behaviors of others. And as a consequence, if people believe the pandemic is hard to control, this may also have important outcomes in terms of perceptions of threat, so how threatful the pandemic is perceived, and beyond that, perhaps even other behavioral outcomes. First of all, let's clarify some key terms. In a nutshell, we distinguish between misinformation on the one hand and disinformation on the other hand. Misinformation is typically understood as information that is false but not created with the intention of causing harm, while disinformation can be defined as false, inaccurate, or misleading information designed, presented, and promoted to intentionally cause public harm or for profit. In our case, and especially in the case of COVID-19, it's very difficult to determine if the information was promoted intentionally or unintentionally. And because we can't know where the information comes from and what the intention was, I will use the term misinformation in my presentation and in this paper. There are two different approaches to the study of misinformation. There's the attitudinal logic and what I call the perception logic. The attitudinal logic means here we want to understand what are the outcomes or the antecedents of beliefs in misinformation. So we want to understand people who actually believe in this kind of information. And for instance, here research shows that misinformation spreads because of its psychological appeal it has, and therefore it impacts individuals. And once established, such misinformation is very difficult to correct according to studies, even when people are informed that the information they believe in is really false and not accurate. This is the majority of research we find in our field. However, there's not only the attitudinal logic, there's also a different logic, what I call the perception logic. And here, individuals may have the impression that misinformation is prevalent, is basically, they see it online, they see it's out there. Or they may even just read news about it, so they have the impression that misinformation is actually spreading toward with respect to a topic. What kind of consequences do these perceptions have? And this is a question I'm going to ask in this research. I theorize that the perception of prevalent misinformation in the context of COVID-19 may create the impression of uncontrollability. So when citizens perceive that misinformation is out there, this perception implies that also others are exposed to this misinformation. And so when misinformation prevails, in the case of COVID-19, the pandemic is arguably difficult to control. Why is that? Because if there's lots of misinformation online, others may believe in the misinformation, and they may act according to the misinformation, which may make it very difficult to get the pandemic under control. And this can be explained by the transactional theory of stress proposed by Lazarus and Folkman. So they argue in a nutshell that individuals continuously evaluate their environment and form an impression whether or not they have sufficient resources to deal with potentially challenging situations. In our case, that means people assess whether they believe a situation is controllable or not controllable. And if misinformation prevails, I argue that this leads to a lack of control, to a feeling of a lack of control, and ultimately to the perception that the pandemic is very difficult to control for society or for humanity. And as a consequence of this lack of control, the pandemic is arguably more threatening, so the perceived threat should be higher. To sum this up in a theoretical model, which I test in a two-wave panel study, we have on the left side here perceived exposure to misinformation in wave 1, and on the right side we see lack of control in wave 2. So the main idea is that when people see that misinformation is out there in wave 1, they are more likely to have a lack of control regarding the pandemic in wave 2. And furthermore, this lack of a locus of control should also impact threat perception. So we can, in a two-wave panel study, estimate the cross-legged effects, on the one hand, from perceived exposure to misinformation on lack of a locus of control, and on the other hand, from the lack of locus of control to the perceived threat of COVID-19. In addition to that, we are also able to estimate all other relationships as the autoregressive relationships or also the reverse causal relationships, as for instance, how does the lack of a locus of control impact perceived exposure to misinformation over time. In addition to that, in this paper, I'm also interested in the actual belief in misinformation. So not only if people are if people believe they have seen the misinformation, but also whether or not they really believe in this misinformation. This way we can test what is the difference between perceived exposure and actual belief in the misinformation. And again, we are able to estimate all our relationships over time, that is the autoregressive relationship and all cross-legged relationships as well. So what you see here is a theoretical model that I tested in a two-wave panel study in Austria. It was a panel study among smartphone users, and this panel study was conducted right during the first lockdown period. That means when in Austria we had a general lockdown that people had to stay at home and basically everything what was closed. In this special situation, we conducted the first panel wave. This was in March and April 2020, and the second panel wave in May 2020. We applied a quota sample for Austria based on age, gender, and education. Let me briefly explain the methods. First of all, perceived exposure to misinformation was measured by asking respondents whether or not they have seen 7 false statements. And we took those false statements from the misinformation that was actually prevalent at the time of the survey. As for instance, the coronavirus was deliberately created in the lab, or government members have exclusive access to effective but expensive treatments of COVID-19. So people were asked whether or not they have seen these statements online. And because this is a formative index, we created a summary score of perceived exposure to misinformation. For belief in misinformation, we took the very same 7 items and asked about the agreement to these items. And again, formed a summary score under the assumption that this is a formative index. Lack of a locus of control was measured with 2 items, such as I have the feeling we have lost control over the coronavirus, and the coronavirus is not controllable anymore. And finally, threat was measured again with 2 items. The novel coronavirus poses a strong threat for the people in Austria, and the novel coronavirus is a huge threat for the health of the people. Let me show you the findings. I did an autoregressive path analysis controlling for age, gender, education, social media use, and topical importance. And what you see here is that the basic assumption that perceived exposure to misinformation in wave 1 was positively related to a lack of control in wave 2 was actually confirmed. There's a significant cross-legged path between both variables in the model. In addition, also according to expectations, there's a significant cross-legged path from a lack of a locus of control to threat of COVID-19 in wave 2. So this basically confirms the theory that just the notion that misinformation, the perception that misinformation is out there, increases the notion that people, increases the feeling that the pandemic is much more difficult to control, so we lose control about the pandemic. And this in turn may also increase threat perceptions when it comes to COVID-19. What is interesting here is, first of all, that there's no reciprocal relationship. So the lack of a locus of control, as well as the threat of COVID-19, were unrelated to perceived exposure to misinformation. So these variables did not explain whether or not people have seen this kind of information online. More importantly, there were no relationships whatsoever when it comes to the actual belief in misinformation. So the actual belief in misinformation did not explain a lack of locus of control, neither did it explain threat of COVID-19. And this is very noteworthy. So it's the actual perception in that case that matters, not the belief in the misinformation. In an additional analysis, I also checked the interaction of perceived exposure to misinformation and actual belief in misinformation on those outcome variables. So here the idea is that if people see misinformation online, does it matter whether they believe in it or not? The findings, there were no significant interaction effects here, meaning that the perceived exposure to misinformation impacts the lack of a locus of control, regardless of whether people believe in the information or not believe in the information. To sum up, this study shows some first evidence that perceived exposure to misinformation can increase perceived threat, and it does so via creating the impression of uncontrollability. So again, people see lots of misinformation online, and this makes them feel that the pandemic is much more difficult to control, which again increases threat perceptions. So in a nutshell, this means the mere perception of misinformation, so the perceptual logic, can have significant effects, even though people may not even believe in the misinformation. And interestingly, the actual belief in the misinformation exerted no effects, which suggests that by and large, there may be outcomes of misinformation according to the perceptual logic that we have ignored or not investigated so far, as the majority of research so far is focused on the actual belief in misinformation and not on the perception that misinformation is out there and misinformation is prevailing. This alone can have important psychological consequences. Of course, there are a number of limitations, as always. First of all, timing and context of the study is very special. The study was conducted in Austria. Situation in Western Europe cannot be compared to other parts of the world, of course. And we did the study during the first lockdown period in Austria. And as we all know, during COVID-19, the situation changed dramatically, not only in the country, but also between countries. So well, we have to be very careful when generalizing these findings. Also, we use self-reports. That means questions like exposure are, of course, to be treated with caution. And more importantly, the underlying mechanisms could not be tested in the present research. This would necessitate experimental research, are looking for the exact mediating processes. And also in a two-wave panel study, we cannot formally test the mediation. We can only observe a relationship over time, but not formally test a mediation. This would also necessitate an experiment or a panel study with more panel waves, so we would be able to formally test the mediation as well. Thank you very much for your attention.